Go to the Blue Room, City Hall, New York City Mayor de Blasio giving a news conference right now.
Area. With the good news, of course, is that everyone has seen this coming and has been preparing all along for this exact situation. I will say up front, I'm going to go into the specifics here. I do think it's important to keep reminding people up front that as much as coronavirus has caused tremendous concern, and for good reason, the manifestation of it for the vast majority of people ends up feeling like what most healthy people go through when they have the flu or a cold. For the vast majority of people, it is something you ride out with some basic medications, it resolves, and you're able to go back to your life. That does not mean for a moment we take it lightly. We obviously understand for a much smaller number of people, it can be a very, very serious threat, and we obviously want to contain the spread. But I want to always start by saying for the vast majority of people who even do end up contracting coronavirus, the impact will be limited. So what we have, you know some of this already, I'll fill in a few more blanks perhaps. We have a New York State resident diagnosed. He is a man in his 50s from Westchester County, works in Manhattan at a small law firm in Midtown, had respiratory issues off and on for the last month, but they became much more severe in the last few days. Was originally hospitalized in Westchester County, now hospitalized at Columbia Presbyterian Hospital and in serious condition. So this individual that you've been hearing about is the new nexus to some particular activity. He is the first patient who required hospitalization in New York City since the coronavirus issue began. He is the first patient to be seriously ill. And obviously we're very concerned because of what appears to be previous respiratory condition, which creates more danger. What we know at this moment, there's always more investigation being done, but there appears to be no recent travel nexus. So this appears to be an example of community spread. Also, talking about this individual's family, 2 sons with a connection to New York City. And again, I will be broad and vague where I have to be, and we'll get you more information very shortly. But both sons are isolated at their home in Westchester County. Both are being tested. One, as I think you know now, is a student at SAR Academy in Riverdale, and that young man has no symptoms at this point. The second student goes to a university in New York City and does have symptoms, and we'll have more to say, obviously, on that front when the tests come back. Giving you an overview just to put this in context and reminding you of the overall situation in New York City at this moment. Separate from these individuals, we have 10 individuals who've been tested previously. 8 came back negative. 1 came back positive. That's the healthcare worker we talked about yesterday who'd been to Iran. 1 pending. That is the healthcare worker's husband. We'll have that result later today. So that's the overall trajectory for New York City. All of this makes clear why we needed local testing all along. And as of yesterday, we finally were able to start testing locally. It's going to make a world of difference in our ability to address this very, very quickly. And just in the nick of time, given what we're now seeing. The work of the famous disease detectives is underway. City Health Department is doing that work, obviously coordinating closely with the State Health Department. In the case of the individual from Westchester County, that family, as I said, isolated at home, being tested. Those tests are being done by Westchester County, working with the state lab. In the case of each of the institutions, our health department has been working closely with SAR Academy, with the local university in question, with the small law firm in question. Department of Health officials at each site working with the leadership of each organization. specifically identifying any cases, any specific situations where there was prolonged contact between the individual in question and other people at that organization. So again, want to come back to this point. Occasional contact, glancing contact, temporary contact does not, from everything we know about coronavirus, lead to transmission. It needs to be prolonged, if not intimate, at least prolonged constant contact. In the case of the small law firm, there are 7 people who work at the firm who have been identified by the Department of Health as worthy of follow-up. That testing will proceed. Others who did not have that direct contact have been given broad precautions and guidance. And that same process is now undergoing with SAR Academy and with the university. We believe as early as today, no later than tomorrow, we will have the map of each individual that came in contact with the members of this family in a more substantial way through each of these organizations. And again, there'll be appropriate follow-up with each of them, very hands-on, very specific follow-up in each case. So, excuse me, I'll conclude and I'll do a little quick Spanish. Again, it does not necessarily, what's the word I'm looking for? When you see something coming and it manifests the way that was expected, that doesn't make it necessarily better, but at least it is what we expected. We have been preparing for this. We have the capacity to address it. We're moving on it very aggressively. Everyone in each institution is cooperating. I continue to tell all New Yorkers to go on with your lives, go on with your business. We are going to be in a very high information environment. I think information is helpful to the people of this city, is clarifying, is comforting. We're going to be providing a lot of information. Right now, again, we have a very isolated situation. People should continue going about their lives. Anyone, however, who thinks that they might have the symptoms, particularly if they have a nexus to someone who's traveled to one of the more affected countries. Again, simple way to address it, call 311. If you have a healthcare provider, immediately get to your healthcare provider, call them at first if you can, get to them immediately. Doctor, urgent care, whatever it happens to be, get to a healthcare provider if you need that. If you have any questions or needs, call 311. If you're not sure what to do, call 311. If you don't have a way to get there, call 311. That is the go-to. In Spanish, creemos, I'm sorry, let me start again. Creemos que ya excuse me, gotta get my rhythm here. Too much English today. Creemos que ya hay transmisión del coronavirus desde entre la comunidad. La ciudad se ha estado preparando para este día y estamos listos. Todos deben de seguir precauciones básicas, pero deben buscar atención médica si tiene algún síntoma. Want to note, joined by Deputy Mayor for Health and Human Services, Dr. Raul Pereira-Hence, our Health Commissioner, Dr. Auxiliar Sparbo, our Emergency Management Commissioner, Deanne Criswell, CEO of Health and Hospitals, Dr. Mitch Katz, Deputy Commissioner for Disease Control at the Department of Health, Dr. Dimitri Daskalakis. And with that, I will turn to your questions about this update. Yes.
I know that MTA is wiping down subways and services. Can you talk a little bit about what's being done with city-owned and run public buildings?
Yeah, we're going to be following that protocol, starting with the schools where a new protocol has been issued. The whole idea here is just intensify our sanitary efforts. It's common sense, it's straightforward. So all city facilities will get extra consistent cleaning. We want to tighten up those protocols, and that will be helpful. Yeah.
How did this Westchester patient get to his job in New York City, and are you tracking his steps? Like, did he take Metro North or the subway? Again,
what we are tracking is the prolonged contact. And I'm sure I'm going to get this question a lot of times. It's a perfectly valid question, but I want people to understand I'm always going to answer the same way. From what we understand, and I'm the first to say the global medical community does not understand everything about coronavirus, but from what we do understand, you cannot contract it through casual contact, so the subway is not the issue. The train is not the issue. The issue is prolonged, consistent contact. As you might have, first and foremost, in a home, that is the number one area of concern. If someone is in a home setting with someone who has the illness. And so I was using an analogy with my colleagues earlier, trying as the layman to get really clear, so I'm going to use the analogy with you guys too. Here's home, here's subway, okay? Home is the issue. Home is the problem, where you're in constant, regular, intense contact with other people, breathing the same air, the same bodily fluids around, like that's the issue. Subway is the other extreme, limited contact in a more open space, short period of time. Subway's not our problem right now. Home is our problem. In between, you have some variables. For example, if you're in the law firm and you're someone working on a case with that lawyer and you're in their office incessantly, sitting right next to them hours upon hours, that's more like home than like subway. So that's what the disease detectives are going to trace. Not did you walk by someone in the hallway, not were you on the bus with someone, but did you have regular, prolonged contact, which inevitably means you bring down the number of people who are of concern, and you can follow up on those people very systematically. That's what we're tracking right now.
So you're not going to say how he...
We've been listening to Mayor de Blasio at City Hall giving an update on the coronavirus situation, saying what's happening is what was expected. He gave more information about the Westchester County man who is in his 50s, works at a small law firm in the city, who has been diagnosed with coronavirus. That's the second person in New York State. They say that this man has not traveled to any of the affected countries, but appears, we've learned otherwise, has traveled from Miami. Because he hasn't traveled to any other country, it appears that this was community spread. Westchester County Health Commissioner still investigating his steps to find out, if they can, how he contracted coronavirus. The man did have a previous respiratory condition for about a month. He has two sons with connections to the city. Both are isolated at their home in Westchester County. Both are being tested. One who is a student at SAR Academy in Riverdale, no symptoms, although SAR Academy has been closed for the day. The other son goes to a university in the city, does have symptoms. We don't know the name of the university, but the student will be tested. That's the latest right now. We will be back here on CBS and New York with more on the coronavirus outbreak.